So medication, you say, well, what about all this medication? I hate to say it, as a physician that gave out a lot of medication, many ways of medication is an easy way out for doctors and for parents. Uh, most physicians don't know about other things. I can talk to a doctor that gives medicine for ADD, and I said, "So when was the last time you ever read through an IEP report?" They have no idea. They have no idea who the team that comes together to develop it. They have no idea how long it takes. They don't even know what a 504 plan is. Um, they do not help their child or their patient learn how to learn. I had a master's level educator in my office because the whole thing, I realized that as a doctor, I was never, ever, ever taught how ADD children or adults learn. Never was. And I is one. So I struggled learning. So we worked at teaching people how to learn. And they came to me, and you take your child to your physician not because of behavior. You take them because they're making bad grades. Okay. But then this behavior thing is what you're hopefully helping. And then you go, well, they're having huge trouble at 5 o'clock or at supper time. He won't sit still, or he won't go do his homework. The guy has been, if he's been on medication, he's been on medication all day. He's coming off of it. Well, quickly, let's give him some more medicine so that he can get through the night. So what are we teaching our child? We're teaching him that he's going to need medicine for the rest of his life to even function. We're teaching that rabbit that he's got to change and know. So what it used to be thinking is that medication worked on the frontal cortex of the brain. There are lots of different fibers. You've heard of gray matter and white matter and these neurons that work at interconnections. And there's thought that now the person with the ADHD brain has different connection patterns than those that don't. Okay, I'm fine with that. But what's this about no ADHD? I'm not saying there's not an issue, but I'm saying don't make me, because my fibers go differently, have to change, have to do things a different way. Go back and try to figure out why is school an 55 minutes hour class and then the bell rings. It's because back in the 1800s they developed a school system to figure out who could work in the factories, and you work for an hour and you take a break. It's not meant for the ADD child. It's not meant for the risk taker. It's not. And what do we want when you first graduate from school? We want risk takers in business. We want you out there trying. Well, have you tried something? No. And so this is my issue. And so that I think medication has become a comfort. I'm not saying not to use, and certainly it helps. We all drink a cup of coffee in the morning, or tea, or something to help us stimulate ourselves. But you know what also works is exercise. There was a study done in Naperville, Illinois, and they had all the kids come in. They went and exercised before school. And then all of a sudden their grades shot up and they became the #1 school in the United States for test taking. Exercise in the morning. And it wasn't just go stand out on the playground, which you see so often. They were doing 3-on-3 or 2-on-2 type exercise. And when I was growing up, you came home and then you immediately left the house and you went out to play. And you went out and you didn't just go sit and twiddle. You went and played basketball, you played football, you played softball or baseball. There was activities in the neighborhood with the kids. And when you came in, you had gotten all that energy that you had pent up during school. It was now out. You were now relaxed. You ate. You then went and you were able to calm and sit and study. What are we doing now? We're doing now is we're coming in and the kids are on this thing. And so they're sitting there talking about just this. There's no activity except with my thumb. And actually, if you will do this in the morning, try it yourself. Try doing your cell phone video for an hour, right when you wake up, get on it, do an hour, and then look at your motivation at the end of that hour. Next 3 days, when you get up, no looking at your phone at all, stretch, and then go for a run or do some exercise. And I mean exercise, jumping jacks, jogging in place, do whatever, exercise and do that for an hour, and then look at your ability to be motivated and to be active.